It's pretty strange when you think about it. How can the same exact virus hit two people in completely different ways? That's the bizarre reality of a virus called RSV. For most of us, it's just a cold, maybe a bad one. But for the smallest people in our lives, it can be a really serious threat. Let's dig into why. And this really hits the nail on the head, doesn't it? It's a paradox that plays out in families every single year. One virus, one cold season, but two totally different stories. So how is that possible? How can one little bug cause such a dramatic split in what happens? Well, the answer is actually surprisingly simple, and it all has to do with anatomy. This is the big question we're tackling today, and understanding the answer is absolutely key to protecting the most vulnerable people around us. First things first, though, we need to really understand what we're up against. Okay, so let's start with the basics. What exactly is this virus that causes so much trouble, yet for most of us, just kind of flies under the radar? So RSV stands for Respiratory Syncytial Virus. Now, that middle word, syncytial, it's a bit of a mouthful, but it gives us a huge clue about what it does. It actually causes infected lung cells to fuse together, creating these big, damaged cells. This damage leads to inflammation and mucus, and it happens right where it causes the most problems, in the tiniest airways of the lungs, called the bronchioles. Just keep that location in mind. It is the key to this entire story. And listen, this isn't some rare thing. RSV is everywhere. It's so widespread that basically every single kid has had it by their second birthday. You've almost certainly had it yourself, probably multiple times, and just blew it off as a simple cold. And this brings us right to the crucial point. For a baby, RSV is not just a cold. The danger lies in a very simple physical difference between an infant's body and an adult's. The whole difference comes down to size. Seriously, that's it. An adult airway is wide and developed, but an infant's airway, it's tiny and fragile. The scale is just completely different, and that's the entire reason RSV is so dangerous for babies. So think about it. In that tiny little airway, even a mild amount of swelling, something an adult wouldn't even notice, can be a really big problem. A little bit of mucus that an adult would just cough up can actually create a serious blockage. All of a sudden, that tiny passage gets squeezed shut, and it becomes incredibly difficult for the baby to breathe. You can really see the difference here. A common cold that usually stays up high in your nose and throat, the flu can hit your whole body. But RSV is pretty unique because it loves to target those lower, smaller airways. And that's why the symptoms for infants are so distinct and so much more serious. For an adult or an older kid, the experience is, well, we all know it. A runny nose, a cough, you feel pretty crummy for a few days, but you get through it. Your body's airways are just wide enough to handle the inflammation without a major issue. But for an infant, the warning signs are completely different and they're way more alarming. Wheezing is a big one. That's a high-pitched whistling sound when they breathe. You want to watch for rapid breathing, or if it looks like they're having a hard time. You might see their chest and neck pulling in with each breath. Also, if they're not feeding well or are just unusually fussy, those are major red flags. So, knowing the danger, the next obvious question is, how does this virus even get around? If we can understand how it travels, we can start to figure out how to stop it. It spreads in all the ways you'd expect, through close contact with someone who's sick, through the little respiratory droplets from coughs and sneezes, and by touching things that are contaminated, like doorknobs or toys, and then touching your face. This makes any place where people are in close quarters, our homes, schools, and especially daycare centers, prime territory for RSV to spread like wildfire from one person to the next. RSV also has a very clear peak season. Cases always spike in the fall and winter, which makes perfect sense. We're all cooped up inside, sharing the same air and touching the same surfaces, which gives the virus the perfect chance to travel. Now we get to the most important part. We know what RSV is, why it's dangerous for babies, and how it spreads. So what can we actually do about it? The good news is that some really simple everyday actions can make a huge, huge difference. Okay, prevention here is really straightforward. First, hand hygiene. Just wash your hands frequently with soap and water. It is the single best way to get the virus off before it can cause a problem. Second, limit exposure, especially during that peak season. If you feel a cold coming on, it's really best to wait before visiting a family with a new baby. And third, protect the infant directly. This means being a bit of a gatekeeper, politely keeping them away from big crowds and anyone who obviously has a cold. These steps are simple, but they are incredibly powerful. And that's really the bottom line. The next time you get a case of the sniffles, just remember that what feels like a minor annoyance to you could be something far more serious for a baby. It's not about being fearful, it's about being aware. Because understanding this simple difference is what empowers all of us to act wisely and protect the little ones who need it most.
Awareness is the first step to protection. Share the knowledge.